In healthcare, getting the patient's story right is, well, it's everything. And you know who the detectives are in this story? They're the clinical documentation specialists, or CDI specialists. Their job is to make sure that story is totally complete and accurate. And today, we're going to demystify their number one tool, the physician query.
So, think about it. What makes sure a doctor's notes, which are basically the blueprint for a patient's entire care plan, tell the whole story with no gray areas? Well, the answer lies in a simple but really powerful communication tool. Let's get into it.
All right, here's what we've got on tap. We're going to start with what a query even is. Then we'll get into the why and when you'd send one. We'll also talk about who's involved and, super importantly, how to ask these questions compliantly. And to wrap it all up, we'll zoom out and look at the big picture, policy and ethics. Okay, first things first, we've got to lay some groundwork. Before we can really get into the query process, we need to get on the same page with a few key terms.
So what is a query? Well, it's way more than just a simple question. Think of it as a communication and education tool. The whole point is to advocate for accuracy. It's about having a professional dialogue to make that health record as precise as it can possibly be.
And one of the biggest reasons you'd send a query is to get clarity on the principal diagnosis. So what's that? It's the one thing, the main condition, that's chiefly responsible for the patient being admitted to the hospital in the first place. And this is a great way to see the difference, right? You've got the principal diagnosis, that's your main reason for admission, and then you have other diagnoses. These are other conditions that might be going on, things that could totally affect the treatment or how long someone stays in the hospital. Getting this distinction right, it's absolutely critical for an accurate record. Okay, so how does a CDI specialist even know when to ask for more clarity? What's the trigger? Well, they're on the hunt for what are called clinical indicators. I love this analogy. Think of them like breadcrumbs, lab results, vital signs, what a nurse wrote down in their notes, all these little clues that point towards a specific diagnosis. All right, so we've covered the what. Now let's jump into the why and the when. What are those specific triggers that make a specialist say, okay, it's time to send a query? This right here, this is the key moment. A query gets sent out when all those clinical indicators, all those breadcrumbs we just talked about, are there in the chart, but the doctor hasn't officially connected them to a diagnosis. The evidence is there, but the conclusion is missing. A query is literally the bridge that connects those dots. Okay, so we know what a query is and we know when to send one. But who's actually involved in this whole dialogue? And where does all the super important information end up living? Yeah, this lays it out perfectly. There's a really clear line of responsibility. So a CDI specialist, or maybe a coder, might be the one writing the query, right? But the person it's sent to, the recipient, is always the physician or provider who is legally on the hook for that diagnosis. They have the final word. And this whole conversation, it becomes a permanent part of the patient's health record, forever. Okay. Pay close attention because this next part is absolutely critical. It's not just about asking a question, it's about asking it the right way. There's a real art and a science to writing what's called a compliant query. So there are basically three main types of compliant queries you can use. First up, you've got your open-ended query. This lets the doctor give a free text response. They're not boxed in. Then there's the multiple choice query, which gives a few different clinically reasonable options to choose from. And finally, you have the good old yes-no query, which is just perfect for those quick, simple clarifications. All right, let's put this to the test. Take a look at this example. A CDI specialist writes this query about a potential case of candidiasis. Read it over. What do you think? Is this a good query? Is it neutral? No way. This is a classic example of a leading query, and that is non-compliant. Why? Because by pointing to a diagnosis from a past visit and asking if the patient still has it, you're basically guiding the provider towards a specific answer. That is a huge compliance no-no. So what does a good compliant query look like? Well, here are the rules. It has to be crystal clear and concise. It must include clinical indicators pulled directly from the current health record, and it has to present only the facts. But here's the big one. You can never, ever mention the impact on reimbursement or quality scores. That is a very serious ethical line you just do not cross. All right, let's zoom out a bit for our final section. It's time to look at the big picture stuff, the policies and the ethical framework that guide this entire process. A query actually has a formal life cycle. Once it's sent, it becomes a permanent part of the patient's record. It's also subject to all sorts of retention policies. Now, what if a doctor doesn't respond? Well, there's a formal escalation policy for that. And the whole thing, from start to finish, is guided by the AHIMA Code of Ethics. AHIMA is the American Health Information Management Association, and they basically set the gold standard for the industry. And, none of this works without teamwork. It's so crucial. When CDI specialists and medical coders are really collaborating, it does more than just help the hospital's revenue cycle. It actually enhances patient care. Why? Because it just creates better, clearer communication across the entire team. So when we talk about success, what are we really measuring? A lot of people might think it's just about the money, but it's not. In fact, organizations that just focus on revenue often end up with the biggest penalties. The real goals, the true measures of a successful program, are quality documentation and better patient outcomes. The financial impact? Well, that's a positive side effect, not the primary driver.
3 years. That's how long you need to really measure success. And this is so interesting, right? To get a real, honest picture of how effective your query process is, you can't just look at last month's numbers. You need at least 3 years of data. And why so long? Because that's how you see past the little ups and downs and spot real systemic improvements. It's the only way to prove the program's long-term value.
And really, it all comes down to this. This quote from the Ethical Standards for CDI Professionals just says it all. The core mission is integrity. It's about never, ever participating in documentation practices just to jack up a payment or skew data. And not only that, but professionals have a duty to report anything they see that's unethical or illegal.
Which leaves us with this final, really critical question to think about. The entire query process is a balancing act, isn't it? It's about making sure a patient's story is told accurately without accidentally or intentionally influencing what that story becomes. The real challenge for every single professional in this field is figuring out how to ask for clarity without crossing that line.